is that something people should not do?
You know, I'm going to say it on TV.
Okay.
It doesn't do anything
Doesn't
bad,
do-
so it's completely
Okay.
fine.
So that cracking your knuckles out of habit is not a bad thing.
It's not going to cause you rheumatoid arthritis,
I've
no.
heard so many pros and cons about that, you know. I used to have somebody work in my office because I do that once in a while. If I get stressed, she says, stop cracking your knuckles, you're going to have arthritis.
No, it doesn't do that. I mean, there has been studies about this, and it showed that there is no increased risk of having rheumatoid in people who crack their knuckles.
I'll be darned. Okay, well, I'm glad we cleared the air on that. Okay, it's one of those questions I was dying to know. All right, we still have about 5, 6, 7 minutes here left in the program. If you have a question regarding rheumatoid arthritis, please give this phone number on the screen a call, 866-969-2720. We're talking to Dr. Deya Obaidat, who is a rheumatologist. All right, so let's move on to some other things here. When is it time to see a doctor if you think you have rheumatoid arthritis?
I think as long as a patient is having any symptom or any pains of any sort that is chronic, giving you any trouble of any sort, I think it's always good to talk to your primary care physician about it. If it's giving you a life compromising situation, if you're not able to function properly, then it's time to talk to your physician about it. Now, in terms of rheumatoid more specifically, we're talking mainly about the swollen joints, especially when it happens to be in the hands, especially when you're stiff in the morning, that pain that gets better when you're trying to be more active. This is the type of pain that can resemble rheumatoid, and this will be a good time to talk to your primary care physician to be checked for rheumatoid arthritis. Maybe doing a physical examination, doing blood work to check for rheumatoid. That would be a good next step, or even doing some imaging like x-rays to look into that possibility.
And once you've seen your primary care physician, who more than likely would refer someone to you who has what he suspects is rheumatoid arthritis, how important is following up with that rheumatologist once you've been diagnosed and possibly been given some medication?
That's also a very good question in here. So it is very important to continue following up with a rheumatologist to get the medication that you'll need to be in remission and low disease activity. Now, what is so tricky about these autoimmune diseases, they're not always in the same activity level. They keep changing throughout the years. It can be more active, less active, and it can be even in remission and completely not causing any problem in the future. But at the same time, we're giving medications that can have implications and side effects at the same time.